I'm Shernan Holtan, Chief of the Blood and Marrow Transplant Service at Roswell Park Comprehensive Cancer Center. I went to medical school at the University of Nebraska in Omaha, Nebraska. Growing up, I was always fascinated with the body. I grew up in rural Nebraska. My entertainment was the local library, and so I would go to the library and check out books about the body. I was just completely fascinated with how the body worked. And so I'd say the beginnings were even as a child in Nebraska going to the library. I chose my specialty sort of by accident. In medical school, I liked a lot of different rotations. I loved surgery, especially plastic surgery. Reconstructive surgery after cancer therapy was just fascinating to me. I did rotations in dermatology, infectious disease, rheumatology, the intensive care unit. I loved all of those things. Wasn't quite sure what I wanted to do when I grew up. And then I did a rotation on the bone marrow transplant service. This is in the late 90s, early 2000s. It was just absolutely transformative. It was literally all of my favorite things in one specialty: cancer care, dermatology, rheumatology, infectious disease. Everything that I was fascinated by was in one specialty. And beyond that, it was really hopeful. You got to help patients go through really difficult treatments, difficult scenarios, and help them come out on the other side, hopefully with a cure. I couldn't wait to join the Roswell team. There are so many possibilities here. We've got incredible scientists, we've got incredible vision, and a plan to really transform this region into an area of excellence for cell and gene therapy. I can't wait to see what we accomplish. Over the past several years, we've had a tremendous opportunity to transform the practice of blood and marrow transplantation and cell therapy. We have developed treatment strategies that have significantly improved the safety. Now it's time to make it easier for everyone to have these treatments. I'm planning on working on ways to reduce the burdens, reduce the cost, hopefully, and expand the access while bringing innovative treatments for patients. We are going to be among the first transplant centers in the world to drastically reduce the burden of care for patients, leveraging that research. The team we've built at Roswell Park is going to be able to bring us into the future. I love helping patients with really difficult problems. I understand from a personal standpoint how scary a diagnosis of cancer can be. I understand how devastating different immune conditions can be. I'm very motivated to help patients and families go through that. I'm excited to leverage the research that we've done to make the transplants and cell therapies safer, more accessible. Most importantly, I want to see patients succeed, and I want to see them, when they're through this therapy, back to living their life, doing the things that they want. We take people along this journey. I am just so grateful when I get to see someone come through this with a smile on their face, and they just say, "Thank you, I'm back."